The Newsday continues here on One News Now. I'm Charles Lejano. The government is looking to start the distribution of aid to affected residents in ECQ areas as early as tomorrow. In an interview with Radyo 5, DILG Undersecretary Epimaco Dinsing expressed hope that the budget will reach the LGUs in time for them to distribute aid within the week. Recall that President Duterte gave the go signal to disburse some 23 billion pesos to extend aid to qualified beneficiaries in the NCR Plus areas to help them weather the week-long ECQ. But Dinsing said it will be up to the respective LGUs whether they want to distribute direct cash subsidy or convert the 1,000 peso allotment per beneficiary into food packs and other essential goods. Either way, Dinsing says the agency will have enough safeguards to prevent the misappropriation of these amelioration funds.
Meron talagang susubok at susubok dyan. So, ang isang pakiusap din natin sa ating mga lokal na opisyales at saka yung mga magdidistribute, sana po sa ating mga puso manggaling mismo, ibigay natin sa ating mga kababayan yung una po. Sa DILG, ang balak po namin maglabas ng hotline para ho dun sa mga hindi mabibigyan, masabihan po yung lokal na gobyerno kung nasaan sila, kung bakit hindi nabibigyan. Meron naman yung receiving po yan, so malalaman po natin yung mga hindi nabibigyan.
Some local executives and health experts are pushing for an extension of the week-long ECQ in the NCR Plus bubble. Rizal Vice Governor Reynaldo San Juan pointed out that hospitals in the province are overwhelmed and are at 85% capacity despite increasing their COVID bed allocation to at least 50%. San Juan added that Rizal is still seeing a spike in cases, even though they've always been compliant with IATF guidelines. He says the health system needs more than a week to regain its bearings.
Itong extension kailangan kasi hindi natin kaagad mararamdaman ang pagbaba ng cases during for the 1 week after this lockdown. Siguro mas maganda na rin kung may extension, at least ma-prepare o maihanda natin yung healthcare system natin.
DOH Technical Advisory Group member Dr. Anna Ong Lim agrees that it makes sense to extend the ECQ in NCR Plus. She explains that PGH, the country's biggest COVID referral hospital, is already beyond full capacity. And Ong Lim says even their pediatric COVID ward is now full for the first time since the pandemic started. She says the increase in cases is taking its toll on the hospital's frontliners.
I have to say that we've never had so many people down kahit nung nagsimula ito. And that's really a very significant drain on our resources. Yung nababanggit nyo kaninang may mga kama pero wala tayong healthcare staff. Yung mga complement mo ng healthcare staff ngayon, marami pang may sakit. So mas lalo talagang mas-strain yung resources.
Traffic authorities continue to enforce ECQ guidelines for motorists and commuters on the last working day this Holy Week. Let's get latest on the IACT's operations with Justine Ponsalang reporting live from Malolos, Bulacan. Justine, good morning. What do you have for us?
Charles, a day before the long weekend for the rest of the Holy Week, the Interagency Council for Traffic, or IACT, are once again making sure that both private and public vehicles are abiding by the health protocols. However, this time around, they are a bit more lenient in their operations. In the previous months, IACT operatives would automatically issue traffic tickets to drivers violating the minimum health protocols and basic traffic rules. But this morning, they chose to give motorists a bit more consideration. IACT enforcers are just flagging down and inspecting vehicles to make sure that the drivers and passengers follow the minimum health protocols, specifically the wearing of face mask and face shield and observing physical distancing. One jeep was found to be overloaded, and the IACT only advised the driver to return the fares paid by some of his passengers so they can alight and find other jeepneys to ride. The IACT reminded the jeep driver that he should not carry more than 50% of his vehicle's capacity as stated in the latest IATF guidelines for the ECQ bubble. Passengers without face shields were given free ones and were reminded of its necessity. Meanwhile, one motorcycle rider was temporarily held by IACT personnel as he failed to present a driver's license and official registration of his unit. But the driver explained his motorcycle was only recently bought on March 5 and his papers are still being processed. The rider added that he does not have a license with him because he does not have enough money to procure one. He said that he felt forced to ride his motorcycle despite not having proper documents because he had no other means of commute. The IAC gave the rider two options. Either he contact a friend who has a license and let him drive the unit, or the IAC will impound the vehicle. But for other drivers and riders who are insisting and justifying their blatant violation, the IAC had no choice but to give them traffic tickets. Charles, the IAC reminds the public that just because they are lenient this morning does not mean that they are giving motorists free passes to violate traffic and IATF rules. IAC said following the protocol should be based on people's sense of care for themselves and their fellow motorists and not on the repercussions that they will face should they violate the guidelines. Charles?
Thanks for that, Justine. That was Justine Ponsalang reporting live from Bulacan. The leader of the WHO team that recently went to China says they felt political pressure in their mission to find the origins of COVID-19. In their fact-finding report, mission leader Ben Mbarek says they experienced political pressure, including from outside the Middle Kingdom during their visit to Wuhan. However, he insists that these pressures did not force them to alter the report. He also notes that the team struggled to get around China's restrictions and privacy laws when accessing raw data. But Mbarek says such privacy concerns exist in many countries.
In China, like in many other countries, there are restrictions on and privacy laws that forbid the sharing of data, including private details to outsiders, in particular if the data are moving out of the country. That would be exactly the same in most countries in the world if we were going there to do any studies, and we've done many studies in the past, and we always face the same challenges.
The White House, however, expressed concern over the WHO's report, saying it does not detail the origins of the virus and failed to meet the expectations of the U.S. and its allies. White House Press Secretary Jen Psaki said a second team of international and independent experts must be sent to China, and they should have unfettered access to data. WHO Director General Tedros Ghebreyesus earlier admitted that data was withheld from WHO investigators.
Well, they have not been transparent. They have not provided underlying data. That certainly doesn't qualify as cooperation.
Vice President of Facebook Reality Labs, Andrew Bosworth, predicts that in about 15 to 20 years, mobile phones could be replaced by more advanced virtual reality technology. Bosworth discusses this with Emily Chang on Bloomberg Technology. Let's listen in.
I think in 15 to 20 years, I think you don't have a phone anymore necessarily, though you may still have a device that you carry with you that's in that form factor that does multiple jobs. I think you probably will have a number of sensors, probably on the wrist for things like input, and it's also pretty convenient. I think you'll probably have things kind of like these AirPods or something equivalent to that if you really want to get more immersed in audio. Audio is so important to feeling immersed in a situation, as well as AR glasses. And I think what's really different actually is our homes and the way they're laid out when you don't have to put TVs in a specific location, when you can work from kind of literally anywhere. And I think cities will be very laid out differently. If virtual reality really takes off and fulfills its promise, why would I fight an hour of traffic to get to my office where they're paying rent to keep it empty all night and I'm paying rent to keep my house empty all day, and fight an hour on the way back when I could, if I really could get great eye contact, that great feeling of presence, why would I do that? I could live wherever I wanted to live, have those rich collaborative experiences. And you know who's going to benefit from those 2 hours I'm not in the car? It's my kids, face-to-face time, the real connection. And so I think VR also has the profound opportunity to change the way we think about cities and where we live in our relationship to work. Because right now, those things have to be together in many cases, because that is the value of face-to-face communication. If you can get at that virtually, that's a big opportunity.
And those are the top stories of VR. Join us again later at 1 p.m. as we continue to monitor the day's biggest stories. Mask on, wash hands, and stay safe, Philippines. And don't forget to stay negative, but be positive. Kaya natin to. I'm Charles Lejano. We are One News.